what the student must know about this lecture. It's important to know what we to know yes, hypospadias, and it is what is management, and this is first, and hemangioma and vascular anomalies, and how you manage hemangioma and what's the complication of vascular anomaly. This is important about to know and lecture. Okay. At the beginning, I ask you, this anatomy is applied anatomy. Just remind you, you take this anatomy. And this is the pens, and this is the glands. This area called the glands. This is glands, and this is the foreskin, and this is glands. And usually the opening of the urethra in the middle of the glands. In the middle of the glands, this is the urethral opening, and this is called frenulum, what is the connected to the purpose or foreskin, and this corona. Just remind you. So when we have hypospadias, I will ask you about hypospadias, and I will ask you what is hypospadias from these are. I will share you the result and show what is the pool. Yes, I ask you, what is the answer? What is hypospadias? Hypospadias is the congenital penile in the ventral or in the dorsal, and it is the urethral opening. What is the true of this? I see the chart. The chart is very important. Active chart means patient, means student participate in conference and ask question. Yes. A, yes. Yes, okay. All answer are true. Yes. A. Yes, in the ventral. Yes, in the ventral. If it is opening in the ventral, it's called hypospadias. If it is opening in the dorsum, it is called epispadias. And normally the orifice found in the middle of the glands. Normally in the middle of the glands. Yes. Okay, right. We continue lecture. Hypospadias definition is a congenital defect in the urethral, where is the urethral opening into the ventral part. Yes. In the ventral part, yes, in the ventral part. And usually found in the penis, in the scrotum, and the perineum, and also it may occur about 0.3, 0.8% in male. In male, yes, about 0.3, 0.5 in male. Yes, it's characteristic by dorsal hooded purpose and chordae, and it may be get paraurethral sinus, urethral valve. 1/5, half of it have inguinal hernia, and 1/5 of it have undescended testes. So this is important associated anomaly with hypospadias. Yes. To see, this is what we call this is called chordae. Chordae is contracture. So it is a chordae-like contracture. And this is what we call dorsal hooded purpose, the skin or the dorsal part, dorsal hooded purpose. And this is opening maybe in the perineum, in the scrotum, in the shaft. This is opening in the ventral, not in the glands, not in the middle of the glands. So it's called hypospadias. So I ask you question. Paul, yes. Question, it is, what is the following will be affected in hypospadias? Difficult in maturation, there is infertility, and there's intercourse difficult, all of the above. Which is true? Yes. Yes, okay, right answer. Yes, yes, all of the above. The functioning will be affected, all of the above. All of the above. Difficult to maturation, decrease in fertility, and difficult intercourse, all of the above. All these are affected. Yes. So, patient unable to maturate, difficult in maturation, there is reduced infertility. How the infertility will be reduced? First, that the semen is not come into the reproductive female organ, come out. It's called infertility. So to prevent semen from entrance inside female genital tract is very important. Second, there is cordy. This cordy make painful or some difficult penetration. All these are lead to affected infertility, and this will lead to formation, what we call a functional problem of hypospadia. Yes. Please close the mic. Yes. Okay. بعض الطلبة لحد الآن اسمهم بالإنجليزي مختار جاسم مثلا، هذا يحاول يدخل، فذولا ما أعرف شنو عقولهم ما تشتغل، خليهم خارج المحاضرة أفضل. Okay, classification of hypospadias, classified according to the site. About 70% in the distal or glandular. This is 70%. 70% يكون distal or glandular. It's just below the glands or in the corona. This is 70%. And about 10% in the shaft, in the middle of the shaft, and about 20% in the pinoscrotal, pinoscrotal or scrotal penile. This is about 20%. So all these are lead to 100%. 70 in the distal part, and 20 in the proximal part, and 10% in the yes. Assessment. How you assessment? First, me assessment, important physical examination, size of the pens, testicular present or not, observation of urine flow if possible, it's very important. The presence of hernia, associated hernia, about 1/50, okay, about half of it have a inguinal hernia, and about 1/5 have undescended testes. So investigation for urinary tract infection also is very important. So what we aim in surgery, what we want to do in surgery, to provide patient with normal looking pens and normal sexual function. This is first. And position of the urethra meatus, normal urinary stream is very important. And very important, the boy not circumcised before surgery. جدا مهم. اذا جينا طفل عنده هايبوسبيديس ما يصير نسوي له سيركمسيجن. ليش؟ لانه احنا نستفاد من البيربوز مالته السكن حتى نسوي له فلاب. اذا سوينا له سيركمسيجن فراح يصير ديفيكالت سيرجري. فيجي بيشنت ما ممكن اجراء السيركمسيجن الا عن طريق تداخل جراحي. بابا ذولا بالانجليزي اسمائهم منهم كلهم بالانجليزي باسمائهم ذولا، ما ندخلهم لان هم ناسين نفسهم. عندك حيدر عبد الاله داود، هذا بالانجليزي اسمه، مختار بالانجليزي اسمه، نفس المشكله تنعاد، ما راح يدخلون من لا يفتهمون الفكره مال المحاضره. Time of surgery. Time of surgery important. How when we dive 6 12 month 6 12 month perfect time من 6 شهور إلى 12 إلى سنة كاملة يكون perfect month. Okay. Continue our lecture. Hemangioma. We end the hypospadias. Hypospadias is a common, about 0.3, 0.8 in male, and it is affected, lead to difficulty in infertility and difficulty in maturation. So it may be surgery important, surgery within 6 to 12 months. We go for hemangioma. We go for hemangioma and vascular malformation. Also this congenital anomaly, either in the blood vessels or in the lymphatics. Hemangioma, congenital, occur in children. It is common, benign tumor, unknown etiology, and it is usually rapid postnatal growth and regress during childhood. It is either hemangioma, it is slow flow in the blood, and while other part hemangioendothelioma, it is capillary, while angiosarcoma, it is lymphatics, miscellaneous venous flow, arterial flow combined. Okay. Clinical feature. Hemangioma is a vascular malformation, and it is usually congenital. Usually in the first 2 weeks of life appear, and there is deep subcutaneous tumor in the skin and subcutaneous tissue, sometime in the visceral hemangioma. May not be manifested until 2 to 3 months. يعني هو يبدي يظهر بالأسبوعين الأولية من ولادة الطفل، وتبدي يزداد هذا حتى خلال الشهر الثاني والثالث تظهر. 80% solitary، عادة تكون solitary. 20% are multifocal, many causes of it. It is more common in female, about every 3 to 5 female, 1 male. The incidence more in white infants than darker, and usually more in a preterm who are weight under 1 kilograms. The phase of hemangioma, there is 3 phases of hemangioma. First, proliferative. Second, involuting. Third, involuted. Proliferation أول ما تبدي تتكون تبدي during 6 to 8 months as the tumor permeates superficial dermis and skin and become raised and postulated يعني and vivid crimson يعني لونه قرمزي واضح، لون قرمزي واضح، vivid crimson color. And if the tumor proliferate in the lower dermis and subcutical region, yes, the overlying skin may be only slightly raised and bluish blue. Yes, bluish hue يعني اكو مسحه من دائره ما دائره الجلد يصير به ازرقاق بالمنطقه ويصير عنده مسحه. So it is proliferating، يبدي فتره يكبر به الحجم. بعدين involuting راح يبدي يسوي regression ويقل السايز مالتها before first year, and time will be decreased. So the sign of involuting, the crimson اللي هو قرمزي fades، يبدي يقل ويبدي يقل ويضمحل اللون مالته ويتغير لونه، و purplish blue hue ايضا يبدي اللون الازرق يخف. This is lead to up to 5 to 10 years. يبدي يقل بعد السنه الاولى، يبدي يقل اللون مالتها ويخف اللون مالتها. و involuting phase 50% of the children within 5 years will be healed completely, and 70% of the 7 years will be healed about for 10 to 12 years. the normal skin is restored approximately about 50% in children. حوالي 50% completely resolved من الأطفال، و50% يبقى فد أثر بسيط عندهم من الهيمانجيوما اللي هي ولادية تكون. هاي types of hemangioma. هنا superficial types، هنا mixed depth، أيضا mixed depth، وهنا superficial. Even hemangioma in the tongue، و this is hemangioma in the body. تعرفون شنو يسموها لأن الناس الهيمانجيوما يسموها؟ تعرفون شنو يسموها الناس بالعامية؟ من يعرف؟ جاوبني من الطلاب. وحمة، يس، يسموها وحمة، أو يقولون تنسى، يعني فشي وحمة، شامة ولادية تنسى. يس، good. وحمة يعني ولادية عادة تروح. Yes. How you diagnose clinically? Ultrasound, MRI, sometime important with contrast, the gold standard. How you manage this patient? Firstly, how you manage. طبعا usually it is discovered by pediatrician. هم الأطفال عادة يكتشفوهم أطباء اختصاص الأطفال ويحولوهم على الجراحين يحتاجون. Firstly, observation. This is observation. Small, harmless tumor. It is observation. إذا عندنا small tumor فشو نسوي له observation, watchful of the pediatrician. شوف إذا any change we can interfere. Second, we use pharmacological therapy, drugs. About 10% of hemangioma cause complication, ulceration, destruction, distortion, and involve tissue. Also, vital structure. Sometime this is indication for medical and surgical. What is the medical use? Start with steroid, corticosteroid, either orally or injection, intralesional. ندفع مادة steroid بالمكان. This is about effective about 85%. This accelerate, regress, and stabilize the growth. أهم هاي يوقف النمو أو راح يساعدنا يقلل يثبت حركته بعد ما يزود بإنكريز إن سايز. propranolol اللي هو اندرال. ليش نستخدم الاندرال؟ سؤال الطلبة. لماذا؟ شلون يفيدنا الاندرال أو propranolol؟ جاوبوني، من يعرف يجاوبني من الطلبة. شنو فائدة الاندرال أو propranolol اللي هو بيتا بلوكرز بالهيمانجيوما؟ واحد يعرف يجاوبني. vasoconstriction. تبارك. صح. Yes. Good. Yes. The propranolol cause narrowing of the blood vessels. Yes. And this narrowing of the vessels will be decrease the blood supply, and this narrowing or vasoconstriction lead to formation and decrease the size of the hemangioma. Yes. Good. We use interferon alpha 2A. This is another other drug. We can use injection locally. Also chemotherapy. Sometimes we use laser treatment. It is very important to remove hemangioma, the top layer of the skin, usually on the skin. Laser effective in hemangioma of the skins. Surgical management. What we do in the surgery. Growing hemangioma can be linked to the tissue expander that provide extra skin. يعني الهيمانجيوما اللي تكبر بشكل كبير راح السكن اللي داير ما داير راح يكبر فيصير فلابي سكين. فحتى من راح نسوي له علاج راح يبقى السكن اكسس، فلازم نشيل هذا الاكسس اوف سكين either by circular excision تشيله ونسوي له بيرسترينج or sometime use transverse, especially in eyelids, neck, and finally we excise. Is very important excision. It is the surgery. Sometimes the best or the golden rule for excision of hemangioma after we use sclerotherapy. There's many types. You see, this is young girls. This is hemangioma, large one. You get many step surgery. This is end result of surgery. Nice result. If leave it, it will be distracted the eye. It will be closed and cause blindness. So excision is very important in this. It is staged by surgery. كل الطلاب دخلناهم بابا، كل الملتزمين دخلناهم بدون ما تذكر انه طلاب عدل، وانا اشوف الفيو مالتي اعرف الطالب ملتزم وما ملتزم. This is many picture. This is hemangioma, and this is all these are hemangiomas in congenital anomalies, and usually it is decreased and fade with age. But this for this young girls, it's important to do surgery. It is because it may distract the eye. Okay, vascular malformation. Vascular malformation, important. Vascular malformation, abnormally channels that line by endothelium. This is vascular malformation. Usually there is a veins and arteries and veins and in between capillaries. If there is a vascular malformation between venous and arterial, or between arterial and venous, lead to vascular malformation. It usually not obvious at birth. They regress often and they never regress and often expanded. يعني هي ما تبين كلش واضحة ببداية الولادة، ولكن تظهر بعد فترة. Usually vascular malformation more with time, not regress. We start with capillary. عادة الكابيلاري malformation. portwine يعني مثل النبيذ، قطعة نبيذ. it is macular أشكال أقراص, red, vascular strain, and present at birth, persisted through life. It can be localized or can be extensive in the face, in the trunk, on the limb. Like this is extensive, this is at the old age, بقت ويا العمر كله. But it is young child or so newly. This is portwine. Treatment, yes, usually treated by flash lamp. نخلي مرات اكو special lamp نخلي، و laser effective also. It is better to initiate it infancy and child. كل ما نبدي من بداية نحصل ريزلت احسن. كل ما نتاخر بداية العلاج الفلاش لامب and pulse dye rays laser, result will be permanent. Ask you question, what is this picture? This is child and this is swelling of the neck. Anyone know what is this picture? I want someone answer me. What is the pioneer? What is the student intelligent? What is, yes, see the first, yes, yeah, no one give me the diagnosis. Yes, cystic hygroma. Yes, good. Noor. Yes, Noor, good. Cystic hygroma. Yes. Yes. Noor al-Huda Saleh. Yes. Good. Excellent. This is cystic hygroma. It is congenital anomaly in the lymphatic malformation. Usually happen in child. It may be there is the channeling of the lymphatic drainage. It may be filled with lymphatic fluids. It may be microcystic or macrocystic. Yes. So usually affected the head, neck, and axilla, and majority of the cases treated by sclerotherapy. Yes, it is usually treated by sclerotherapy. تعرفون شنو السكليروثيرابي؟ السكليروثيرابي نجيب داي اللي يسوي السكليروزنج ايجنت نزرقها بالشانلز يسوي اوبليتريشن and this will obliteration راح decrease the size. After that we go for surgery for easy surgery. Sclerotherapy, the major rule in the management, and then resection because we have redundant skin, excess skin, so it may be excised. Yes, we go to the what we call venous malformation. Venous malformation, we this is lymphatic and this is venous malformation. Yes, venous malformation are present also at birth, and it is not always evident. They are bluish, soft. This is venous, this is normal venous, and this is venous malformation here. And it's compressible, يعني نضغط عليها يصير emptying، مؤخر ايدنا راح يرجع البلد supply. Maniform or localized or extensive within anatomic region and are typically located on face, limb, or trunk. A surgical resection is considered after completion of sclerotherapy. After that, we do surgery for reconstruction and for cosmetic indication also. Where we go for the arteriovenous malformation. This is the normal blood vessels and abnormal connection blood vessels. Usually between arteries and veins, there is a capillary bed presented with this. If the capillary bed are distracted, so the vein come to the artery and leads to a thrull. Thrull is تعرفون شنو الثرل؟ الثرل يعني فد موفمنت تحسوها بالتشو، اذا تحط ايدك تبين، بينما بعدين ما يصير بعدين بروي راح يصير صوت تسمعه بالسماعه. فبالبدايه يبدي الثرل because machinery effect of the vascularity، بس يبدا بانه اذا واحد شايفين مسوي AV فيستولا او AV شنط اللي جماعه يوريمه، من تخلي ايدك على المكان فيزيو تحس اكو ثرل بالمكان، وتقدر تسمع بالسماعه بروي pulsation. طبعا this is very because it develop growth disturbance حتى تسوي لك skeletal distortion. يعني هاي الفيميل شوف young nice girls، شوف يبدي هذا الاي في malformation راح يسوي لها skeletal distortion، تبدي الاي مالتها تنسحب ويبدي التشيك مالتها يتغير فيسوي لك skeletal distortion. وهذا young او عنده AV malformation و treated well. This is nice after surgery. follow up immobilization، يعني نزرق ماده بالفيدنج ارتري، يعني هذا الارتري نجيب هنا نخلي به ماده، هاي الماده راح تغلق الارتري وراح نسويها نسميها immobilization، وراح كلها distracted والفين كلها distracted. After that we go to the surgery with an immobilization. By emboli we put emboli inside the vessels and we obstruct it, so distracted. After that we go for surgery. What's the complication? What's the complication of the vascular? شنو الكومبليكيشن اللي تصير عندنا بالفاسكولار anomalies؟ obstruction بالايرواي، بالفيجوال اكسس، اذا يم العين ما يقدر يشوف المكان مالته. distortion lip, nasal, eyelid. destruction by skin erosion and cartilage, ulceration, bleedings, و altered physiology. Why there is altered physiology? The large number can be cause heart failure and hepatomegaly and anemia. طبعا هاي من الاي malformation من تكون big one راح يسوي heart failure، لانهم باي باس فين يروح ويا الارتري، فالسيركوليشن كلها تتغير فيصير عندنا heart failure. ولوكاليزيشن hypertrophy. Why? Increase blood vessels. هي نفس البلد vessels من increase in size يسوي لك hypertrophy and this will be increase the size. Associated syndrome اكو Sturge-Weber syndrome هذا associated with AV malformation which is port wine. هو عبارة عن port wine stain, trigeminal disturbance, convulsion and visual impairment. Why? There is capillary malformation in the meninges and also in the area of the face innervated by trigeminal fade nerve. Okay, I go for a question regarding Sturge-Weber syndrome, which is true? Ipsilateral port wine stain, ipsilateral glaucoma, ipsilateral leptomeningeal angioma, all of the above. Who know the answers? Ahmed Ghassan, yes. D. Amir, good. Tabarak, good. D, yes, all of the above. Yes, it is a AV malformation of the brain and yes, good. Good. All of the above. There is port wine stain, ipsilateral glaucoma, and yes. Anyone know the diagnosis? Anyone know the diagnosis? Anyone know the diagnosis? Anyone know the diagnosis? Yes, hemangioma. Good. It's hemangioma. It's called port wine hemangioma. مثل الكريمسون قلنا هاي تكون رمادي. Port wine hemangioma. Good. Yes. Good. This is patient after surgeries and sclerotherapy and surgery get this result. This nice result, acceptable. It protects the eye. If the hemangioma increase more and more, will be distracted the eye. So this is the result after surgery. Good, nice result. And usually after we become 12 or 10 years, there is regression in the color, and we can monitor the patient well. For a vascular tumor, just use this picture, vascular tumor, either infantile hemangioma is infantile or congenital, the same. Cabosiform hemangioendothelioma. This is in the lymphatic. This is cabosiform. We go for this picture, the vascular malformation, either a slow flow or fast flow. AV malformation. Arteriovenous malformation. This is arteriovenous malformation, and this is lead to. This is slow flow capillary malformation. This is capillary. Venous malformation here, and also here, and there is lymphatics malformation. This is in the breast. For vascular tumor, this is the same slide, I think. Okay, we go. For vascular malformation, also this is fast. This is the fast and slow. This is slow flow and fast flow. Capillary malformation, AV malformation, generalized lymphatic anomaly, where glomerulus malformation or varicose venous malformation. Okay. Yes. And there's syndromes with vascular malformation. اكو بعض السندرومات اللي هي with vascular malformation مثل ما قلنا Sturge-Weber syndrome, اكو Parkes-Weber syndrome, Kibble-Tronani syndrome, and gloves. This is sometime come in examination, ask you the syndrome and of malformation. You must know what is it. Is a systemic vascular malformation. It is vascular malformation in the skin and in the brain and in the eye. So it have get many anomalies. Kibble-Tronani, Serge-Huber, Parks-Huber, and gloves. For stages of a hemangioma, in the first at birth is at birth. After 2 months, it's more progress, and after 9 months, involuting will be regress.